taking on hospital admission and discharge. Okay. If you cannot see the slide, please tell me. I will start sharing my slides now. Can you see everyone?
Yes, ma'am. Yes.
Okay.
Yes, ma'am.
So, okay, before proceeding, my name is Anushya Goswami, okay, and I am a lecturer in Faculty of Nursing. I have done my specialization in child health nursing, okay. So, coming to admission and discharge, first I'll be discussing about admission procedure. Can anyone tell me anything? What do you mean by admission procedure? Any idea that you have? Anybody?
Ma'am, when patient came in hospital, admission procedure include, ma'am, patient name, age, like this one, and patient case, incident case, accident case, or normal OPD case, or examination or gynecology case, ma'am. Just which case, which type of, ma'am, which type of the name is for.
Yes, very good. Sandeep, right? You are talking? Okay, very good. So admission is whenever a patient comes to a hospital for any procedure, it may be a routine admission, okay? It may be due to any investigation. Sometimes what happens if there may be investigations which takes time and patient needs to be admitted in a hospital. So in those cases, we use this admission procedure is done, okay. So it may be from emergency you might admit your patient, or from routine, from OPD basis you might admit your patient, or maybe from transfer means if you transfer a patient from one patient, suppose a patient was admitted in medicine ward, okay. If a patient is admitted in medicine ward, but he is referred to another ward, maybe surgery ward, so he will be transferred from medicine ward to surgery ward. So that will be another admission procedure for the surgery ward. Okay, when the patient is transferred from one ward to another, also admission procedure is used. Okay. So coming to, just a minute, okay. Okay, coming to the definition of admission procedure, as your friend has already said, and I have already explained definition, it means allowing a patient to stay in the hospital for observation, investigation, and treatment of disease he is suffering from. Okay, can you understand this sentence? It means allowing a client to stay in the hospital for observation, investigations, and treatment of disease he is suffering from. Okay, observation means there are some disease which needs the doctor to observe the patient for a time being. Okay, so in those cases, the client or the patient is usually advised to be admitted in the hospital. Then in investigations, okay, some investigation needs time. We need to prepare the patient for those type of investigation, and for those investigation also we need to admit the patient. Okay, and the last one is for treatment of disease he is suffering from. I guess everybody understand that, right? Next definition is, it is the entry and acceptance of a patient. Okay, it is the entry of a patient to the hospital, and the hospital has accepted the patient to be admitted. Okay, to stay in a hospital or health facility for the purpose of observation, investigation, and treatment. Okay, so clients coming in for admission may walk in ambulant or not. So ambulant means those patients who can move around, those patients who can walk. Okay, those patients are called as ambulant patients. Or those, or sometimes a patient might come in a wheelchair or a stretcher too. Okay. Did you all get the definition? Okay, moving on to the types of admission. So there are three types: I've already explained in the introduction, there is emergency admission, routine admission, and transfer. So emergency admission are those type of admission in which the clients are admitted in acute conditions which require immediate treatment. For example, can anybody give me an example of emergency admission? Any disease condition or anything that requires emergency admission?
Accident, ma'am.
Sorry, I can't hear you.
Ma'am, accident.
Yes, very good. Accidents. Accidents are the most common emergency admission, right? So accidents, and then there might be other health conditions like heart attack. Okay, so in those cases, we need emergency admission. The next is routine admission. So clients are admitted for investigations and planned treatments and surgeries. As I've already said, those some investigations need time and clients need to be admitted, okay? And some planned treatments and surgeries. For example, patient wants to undergo a cataract surgery. I hope you understand the meaning of cataract.
Yes, ma'am.
Okay, suppose the patient is planned to undergo a cataract surgery. So that is a planned surgery, right? So the doctor will advise the patient to get admitted for some time so that the surgery will be successful. Okay, so that is called routine admission, means that are planned from before. Okay, and according to the plan, the clients will come and get admitted in the hospital. Okay, now coming to the third type, that is transfer, means as I've already explained, transferring from one ward to another ward. For example, right, a patient came to emergency room, okay, in case of suppose road traffic accident. So now the patient will be transferred from emergency to say medicine ward, okay. So that is a transfer, right? Transfer from emergency room to a medicine ward. So that is a transfer. So that also will come under another type of admission. You understood?
Yes, ma'am.
Okay. Next, coming to steps of admission procedure. So what are the steps? First, we do admission in two different areas. That is OPD, outpatient department, and next is in IPD, that is inpatient department. Okay. First, let's see about the outpatient department. First, we will do receiving the patient or receiving the client. I hope you all know what is receiving the client. As soon as you go to the hospital, what happens? You will go and see your name, your age, sex, your address, from wherever you are coming from, which doctor you want to meet, all those will be there, right? That is receiving the client, okay? And the person who is receiving the client or patient has to be very humble and has to comfort the patient, because the patient will come in a very distress situation, right? The patient will be having some problem and he will come in a distress situation. So the one who is receiving the client should be very humble and should make the patient comfortable, okay? Next is recording of social and medical data, right? Next, what they will do, one clerk in the medical room or in the clerk section, what they will ask the same, like in a detailed way, okay? Like what is your name, your parents' name, from where you have been, okay? Like what is your problem, then which doctor you want to meet, whether you want to, whether you have met the doctor before or not, whether this is your first time of admission, okay? All those they will ask in a detailed manner, okay? So that they will keep a record of you in their hospital, okay? So that is all, that is recording of social and medical data. Next is medical examination. After the client has been received or the patient has been received, after the medical and social data has been recorded, you will be sent to the doctor, okay? So this medical examination, the doctor will do. What does the doctor usually do when you go to meet a doctor? First, again, they will introduce, they will ask your introduction, right? Who are you? Okay, you came with whom? Did you come alone? Your age, then your uh, your address and all, right? Then they will ask what problem you are having, right? Then what the doctor will do, they will check your blood pressure, then they will check your temperature, they will check your respiratory rate. Okay, then the doctor will do a quick physical examination so that the doctor will come to know or will be able to rule out the problem that the client or the patient is suffering from. Okay, understood? These 3 points. Any doubt?
मैम
Yes.
मैम वो जो सोशल डाटा और मेडिकल डाटा आपने बताया ना, वो सोशल डाटा मतलब दोबारा थोड़ा बोलते हैं, सोशल डाटा एंड मेडिकल डाटा.
I can't hear you. Can you write in that chat section? I cannot hear you. Your voice is breaking.
Ma'am, recording of social and medical data.
Okay. So in recording of social and medical data, what we'll do is after we receive the client, after the client is received, client will be received where? In the section like admission section, right? Someone will be sitting there, you will be asking where to meet the doctor, which doctor, like that. That is the receiving of the client. In recording of social and medical data, what they will do is they will try to ask about you, okay? Like what is your name, what is your age, did you come alone, okay? Then which doctor you want to meet, whether you have met the doctor, means you have done checkup with that doctor from before or not, if you have any past history, okay? Past history means suppose you have met that doctor before, you have came for another of your disease and you have consulted with that doctor, then that is called past history, okay? So whether that you are a new admission, okay, whether you are coming to meet the doctor newly or from before you know the doctor, you have met, or this is a routine checkup, okay? So all those they will ask in the recording of social and medical data. Did you get?
Yes ma'am. Ma'am, recording of social data के अंदर में मतलब
social data is yes, social data is about you, okay? Like what about means from where you have been, okay? Whether you're coming alone, then what is your age, your name, all those in detail they will ask about you. That is social data, okay? Then in medical data they will ask about the doctor, means about what problem you are having, then which doctor you want to do checkup, whether you have any other checkup you have done with that doctor or not, whether you have any investigations done or not, okay? Do you have any investigation record or not, okay? So all those will come in